swine flu are now being reported this morning in New Jersey, South Carolina, as well as North Carolina. That's a total of 50 cases now in 8 U.S. states. So what are health officials doing at the federal level to stop the spread of swine flu? Well, Dr. Richard Besser is the acting director of the Centers for Disease Control and Prevention, and he joins us from the CDC in Atlanta this morning. Thanks for being with us, Doctor.
Thank you very much.
So we're talking about these new probable cases being reported in New Jersey as well as North and South Carolina, and that's in addition to the 50 confirmed cases. So where does the CDC total stand this morning?
Well, you know, I think it's important that people realize as we look, we're going to continue to find cases. And focusing on the numbers is less important than what they tell us. Our numbers, we're still reporting 40 cases in 5 states. We'll be updating those numbers later this morning. And we'll be doing so once a day. What we are finding is, as public health officials are looking in states, they're finding cases of flu, and they're testing those cases of flu to see if they could be swine flu.
All right, and it is important to point out that as of this point, there have been no deaths. You, though, said that you'd be surprised if we didn't see more severe cases in the U.S., maybe some deaths. When do you expect that we have a true handle on the scope of this problem?
Well, I mean, that's a great question. What we're seeing in the United States so far is 40 cases, one of whom was hospitalized. They've all recovered, and we're very thankful for that. What we're hearing about and seeing in Mexico is a much more severe outbreak of flu with many deaths. The viruses appear to be the same, and because of that, I expect that as we continue to look for cases of flu, we'll find more severe disease. And unfortunately, given what we know even from seasonal flu, some people die from the flu.
Yeah, right. And we talked about this 36,000 deaths from just influenza during flu season each year here in the U.S. How do we prevent, though, against what you said, the possibility that it could become more severe? We could see more severe reactions and symptoms here in America.
Well, we're concerned, and we know people are concerned, and what I'd like is for people to take this concern and turn it into responsibility. There are actions people can take, and there's planning people can take. In terms of actions, at the personal level, doing those things that are going to reduce the likelihood you get sick. So frequent hand washing or use of alcohol hand gels, covering your cough, not with your hand, but with your sleeve or your shoulder. And not going out if you're sick. If you have a fever or you're sick or your children are sick, stay home.
Good advice.
Those things can help.
Right now, the EU is warning against all non-essential travel to America. Yesterday, you said you didn't think that was warranted. Do you still feel the same way today, considering we've now seen the number of cases here in the U.S. double since yesterday morning?
You know, I do not think it's that recommendation is warranted at this point, and it's important that we continue to monitor the situation. At this point, we are seeing cases in the United States, but the severity is not at the level that we're seeing in Mexico, and so I think it's a premature recommendation. It is time, however, for people to be thinking about what would I do, what should my community do if we saw cases, and that kind of planning. Thinking about what would you do if your child's school was not going to be open tomorrow, or if your work asked you to work from home. Businesses should be thinking about what should we be doing if we did not want to pull all our employees together. Is there a way that we could work more remotely? That kind of planning that's been going on for years, it's time people dust those plans off and look and see what they would be doing.
All right, and I want to ask you about this. The U.S. health officials that are advising against non-essential travel to Mexico, should we be concerned? What's the difference between what we're advising people regarding Mexico and what the EU is advising versus America?
Right. We initially had an outbreak notice up so that people were aware of the outbreak, and it's important that people around the world are aware of the outbreak in the United States. This increased warning, this warning against non-essential travel, is a recognition of the severity of the outbreak in Mexico, and the fact that we don't know as much about that as we would like to know. As situations change, we'll continue to evaluate that warning against non-essential travel to Mexico.
Would you, if you had a vacation plan, you and your family, would you go to Mexico right now? Would you advise people to maybe rethink those plans?
You know, based on what I know as a public health professional and as a physician, I would not recommend that people go on non-essential travel. So if I had vacation plans for Mexico coming up right now, I'd look to postpone those.